And now, here is your pandemic news report. What's going on, everybody? Welcome to the pandemic news report. And today we're going to do our live global, real-time global health threats watch. All right. And incidentally, there's been some reports, a lot of talk about measles in the U.S. and specifically South Carolina for some particular reason. So we're going to take a look at the home of the FBA, USA. And I guess the first place we'll take a look is South Carolina. All right. We'll take a look at South Carolina, what's going on there. There's been a lot of talk about measles. Okay. A lot of talk about measles. So let's take a look. Let's take a look and find out what's going on. All right. First, let's hit this one up and see what's going on here. Okay. All right. There's an update. Measles cases reach 135 in current upstate outbreak. Okay. Again, update. Measles cases reach 135 in current upstate outbreak. The South Carolina Department of Public Health announced Tuesday that 9 more people have gotten sick with measles in the upstate, bringing the total number of illnesses in the current outbreak to 135. All right. It's by the South Carolina Department of Health, DPH for short. The additional illnesses bring the total number of cases in the current outbreak to 135. In all, 138 people have gotten sick in the state this year. All of the new cases are from previously known exposures. Department of Public Health also reports that 168 people are currently quarantining and 1 person is in isolation. Additionally, Department of Public Health has identified public exposures at another school in the area, Berry Shoals Elementary. State health officials urge those who may have been exposed to contact their healthcare provider before seeking treatment to lessen the risk of public exposures in medical offices. A person with measles is contagious from 4 days before the rash appears through 4 days after its onset, meaning people with mild symptoms can spread measles before they know they have the disease. Other important information about measles and the latest on the current update outbreak can be found on their website, the DPH, Department of Health South Carolina's website. And we'll take a quick look at that. Let's look at the current situation. Department of Health is actively responding to a measles outbreak in the upstate region as of December 16th of this year. They got the reporting cases, and since July 9th, 135 centered around Spartanburg County in the current outbreak. On October the 2nd of this year, the Department of Health confirmed the measles outbreak in upstate region. I think we reported that and kept y'all up on what was going on with that in South Carolina. An outbreak is defined as 3 or more cases. Keep this in mind. 3 or more cases of the same infectious disease linked to a common exposure. There has been a rise in measles cases. I thought measles was already done with. I thought they got rid of that years ago, but apparently it's made its way back. So there has been a rise in measles cases in the upstate this year, the most concentrated in Spartanburg County. So anybody's living in Spartanburg, South Carolina, Spartanburg County, beware. Excuse me. Some cases are travel related exposures or close contacts of known cases. So again, they're trying to say that some of these cases are travel related exposures. So they're trying to say that people who have traveled somewhere is what I'm gathering, and they're trying to say that that's where these exposures came. Somebody traveled and then brought it back to South Carolina. That's what I'm getting the understanding of. So again, they say in some cases are travel related exposures or close contacts of known cases. Excuse me. Other cases have no identified source, suggesting that measles is circulating in the community and could spread further. We have seen measles spread quickly in unvaccinated, here we go with that word, unvaccinated households here in South Carolina. We also know that it can spread quickly in unvaccinated communities based on outbreaks in other states. All right, so here's some key takeaways. Measles is highly contagious. Okay. A person is contagious 4 days before and after a rash begins. So 4 days before they see a rash, and then 4 days after the rash starts. So that's where they're considered a person being contagious. So my thing is also how would they even know? First off, how would they even know beforehand? I guess they do the testing, right? Test them, and then even though they're not showing a rash, and it might be 4 days beforehand, so they can be in monitor. So 4 days before and after a rash begins, you consider contagious, meaning someone can spread measles before they know they are infected. The virus can linger in the air for up to 2 hours after an infected person leaves. That's very interesting and very important. So, again, the virus, this is the measles now, the virus can linger in the air, is what they're saying, for up to 2 hours after an infected person leaves. So you could have they're saying you can have an infected person who has measles and they can leave and you still in the area where this person was at, and it can still be in the air after that person leaves, 2 hours after they leave. The measles vaccine, MMR and MMRV, is the best way to protect yourself and others against measles. Use the Department of Health recommendations for measles vaccination chart to understand if you need to be vaccinated or not. All right. So Spartanburg County seems like it's getting concentrated with the measles, it appears. Okay. So let me take a look at another set of information regarding this real quick to see if there's anything different before we continue on the health map. Currently, 168 people are quarantined, and one person is in isolation, according to officials. The additional cases led to new public exposure as Berry Shoals Elementary, where 44 students are now in quarantine. Students also remain in quarantine at Campobello Grambling School, with 67 students affected and 16 students in quarantine at Boiling Springs Elementary. Let me see. Reported 9 measles cases, bringing the total to of number of cases connected to the upstate outbreak to 135. The state's total number reported is 138 of this year. Okay. Let me pull this up real quick before we get back into it. Okay. Let me see what we got here. All righty. I just want to show you these images. All right. There you go. When it comes to these measles cases. Okay. There we go. All right. Health officials said anyone who may have been exposed should seek medical care after notifying a healthcare provider so precautions can be taken to protect others. Department of Health said the clinical settings have also been sites of public exposure. A person with measles is contagious from 4 days before a rash appears through 4 days after its onset. Okay. So keep that in mind. All right. As we're going to go back to the health map. Okay. All right. We got the health map back on the screen. And let's take another look, man. Let's go on to another one. Let's see here. Looks like there's some measles cases in California as well. Let's see what's going on with that. Excuse me. Oakland County reports second measles case of 2025. And that's all it looks like they're saying as of right now. New measles case, pediatric patient, second confirmed case this year, DMC Huron Valley Sinai Hospital on December 6th, may have been exposed between 7:20 p.m. to 11:10 p.m. All right. And again, that looks like Oakland County health officials reporting that confirmed measles case. All right. Let's see what else is going on. So you got South Carolina and you have San Francisco, both on different coasts, and you got measles cases going on. Okay. Let's see here. New flu variant causing cases to spike in multiple counties. Let's see where this is at. It says United States, but let's see if we get any details. Okay. A flu season, let me see. This looks like it might be going on in the UK, Japan, and Canada. Canada being the closest to us. As flu season continues on, a new variant, so they say known as H3N2 subclade or subclade K is causing cases to spike in other countries. Excuse me. So that's causing cases to spike in other countries, which includes the UK, Japan, and Canada. Canada being closest to the US. Okay. A microbiology and immunology professor at Johns Hopkins said, while numbers have been low in the United States so far, that is likely to change. It's very difficult to predict the flu season But right now, we're at the beginning of what we are probably going to see is a pretty severe influenza season. Okay. Respiratory illnesses case or cause thousands of deaths in the US each year, and that it is not too late to get vaccinated. Be very mindful if you're going to get vaccinated. Make sure you're making the right decisions on that. Nothing can be trusted 100%. And with the way things have been going around here in the US, a lot of games have been being played when it comes to vaccines. And, we can get into a whole lot of other agendas that could be the reason why a lot of games are being played. But we're just going to keep you focused on, what type of diseases might be going on out here. And so you can just be aware of it at the very least. Let me see. 51 suspected of confirmed cases of botulism poisoning. I don't know where this is at. Let's see where this is at. Let's find out here. Okay. 51 suspected or confirmed cases of poisoning have been reported. The United States Food and Drug Administration warns remove botulinum toxin contaminated milk powder products from the shelves in a timely manner. The FDA issued a communique on the 15th saying that many states in the U.S. have recently continued to report cases of poisoning related to the consumption of infant formula. I think we reported that a few weeks ago, that some children were getting some issues from drinking some of these baby formulas, and that may be contaminated with Botox. I don't know if that's a typo or if that's for real, the Botox word, or do they mean something else? Although the company involved launched a comprehensive recall of the relevant product in November, some retailers have not removed the product from the shelves. See, not taking responsibility. We need to find out what stores those are, those retailers. The US FDA has issued warning letters to a number of retailers in this regard, asking them to effectively fulfill their recall obligations. So we have stores, retailers being warned by the FDA, and some retailers have not moved some of these products off the shelves. Let's see if we can do a search real quick and see if we can find out which stores that might be. Okay, let's do something real time. And see if we can pull something up here. Let's see what's going on here. Let's see if we can get something pulled up. Let's see here. Let's see what we have here. Recap so we're on the same page. Federal health officials, FDA, CDC, linked an outbreak of infant botulism from Clostridium botulinum, I think is how you pronounce it, to By Heart Whole Nutrition Powdered Infant Formula. A full recall of all By Heart infant formula product. I think we reported this a couple of weeks ago, and they still some places still haven't removed it. Let's see what happens here. A full recall of it was issued after dozens of babies were hospitalized. Recall means those products should not be sold, but inspectors have found them in stores after the recall. Retailers that have been reported as still carrying recalled By Heart formula after FDA notifications. And I think this is something that we're going to probably go take a look and see. And if we see any in the stores, we'll report it to you. The FDA issued warning letters to several major retail chains because inspectors found the recall formula still on the store shelves well after the recall was announced. Walmart found to have recalled formula in stores in many states after the recall, FDA warnings issued. Target, recall formula found on shelves after recall in at least one report, even discounted during the recall period. Even discounted during the recall period. So they sold it for a discount. That's what it seems like they're saying. They sold the darn thing for as a discount for a discounted price. Hold on here. That's crazy. Kroger, warning letter issued for not removing recalled product properly. Albertsons and affiliated banners like Acme, Safeway, Shaw's, Star Market, Smith's, King Supers, also cited by FDA for continuing to have recall formula. So I wonder what's the punishment when they're being advised to remove these things. We're talking about the kids, man. What is really going on? What is the punishment to these companies? What is the FDA able to do to these companies, if anything, other outside of just sending letters to them telling them, hey, we gave you a warning. Hey, you still have these products in the stores. So what that actually means, the FDA has not accused these retailers of deliberately withholding the recall, but inspectors did find the recalled formula still available at some store locations, even after recall notices were issued. The retailers have been given time, usually 15 working days, to respond with corrective actions to the FDA. Some retailers, Walmart, Albertsons, in statements maintain they remove product quickly or they remove the products quickly. The FDA's findings say the removal was not consistently swift or complete across all stores. So Walmart and Albertsons is saying now none of the other stores have said anything apparently. Kroger's and Target and Acme and Safeway and Shaw's and Star Market and Smith's, King Supers hadn't said anything, but Walmart and Albertsons claimed in statements that they made, they removed the products quickly. The FDA's findings say otherwise, say the removal was not consistently swift or complete. Okay, so important safety notes is all By Heart Whole Nutrition infant formula products. Again, By Heart Whole Nutrition infant formula products. All lot numbers, all sizes, cans, and single serve packs were included in the recall and should not be consumed. All right. I remember we reported this a while back. We reported this a while back. Indeed. So what is going on? Why are they still having this stuff out? And people might be buying it for their children. This is crazy. So again, all by heart, BYHEART, whole nutrition infant formula products, all lot numbers, all sizes, cans, and single serve packs were included in the recall and should not be consumed. This is a serious botulism exposure risk situation. If you or someone you know has leftover by heart formula, do not feed it to infants and check lot codes designs against official recall listings. Okay. Let me see here. Let's do a quick search real quick. Let's see what we can find here. Okay, let's see here. Brand again is By Heart Whole Nutrition Infant Formulas. 24-ounce cans. The UPC code is 500-449-6800. Again, that's a 24-ounce can of UPC code 500-449-6800. Then you have a 0.6 ounce single serve anywhere pack. Okay. Again, the 0.6 ounce single serve anywhere pack, that UPC code is 500-449-6802. All right. So the only difference between the 24-ounce can and the 0.6 ounce single serve anywhere pack is the last number on the UPC code. The 24-ounce can ends in 0, and the single serve ends in 2. All right. All lot codes and expiration dates on these products are considered recall. The recall isn't limited to specific codes anymore. Do not feed the baby. If you have it at home, put it on, label it, write something on it, throw it out if you need to. Put do not use, contact the retailer for a refund. If your child drank it and shows symptoms, which is weak feeding, droopy eyelids, constipation, trouble breathing, then seek medical care immediately. All right. Again, if your child has drinking some of this infant formula, the By Heart Whole Nutrition infant formula, and shows symptoms of weak feeding, droopy eyelids, constipation, trouble breathing, then seek medical care immediately. Again, the retailers found still selling recall formula after the notification appears to be allegedly to be Walmart, Target, Kroger, and Albertsons, allegedly. All right. These findings were documented in Food and Drug Administration's warning letters that the agency released after inspecting stores post recall and finding recall products still available for purchase. So the FDA saying they went in, they sent these recall letters out. And why would it be a recall letter? Don't the letters take a while to get to, unless they can just get them things there quickly to people? That's kind of weird. That's something in itself. They should be able to either notify these stores immediately by phone, unless they send in letters FedEx next day. You know what I'm saying? So yeah, we reported this a couple of weeks ago. We were staying on top of all this stuff, and it seems like it's getting worse now. So If any of you have children that are drinking this by heart whole nutrition formula, you might want to get rid of it ASAP. Okay. And then start looking for symptoms: droopy eyelids, constipation, trouble breathing, or weak feeding as potential symptoms if your child has drank this. And I already gave the UPC codes and all of that. All right. And again, the recall itself covers all by heart whole nutrition formula. All right. Yeah. So definitely get that taken care of. Looks like botulism poisoning is in the infant drinks in the United States. Okay. Let's see what's going on. What else? I think we talked about the flu variants that they have. I think it's what, H3N2, I think is what it was. We talked about the Carolina measles seem to be picking up. I'll say it like that, picking up. It's starting to increase. The cases are starting to increase. I think that was Spartanburg County. And then they mentioned a few elementary schools. So if you have family over there, in South Carolina, let them know. Let's see what's going on in Florida. Recent Florida cases of chikungunya linked to Cuba travelers. Imagine that. And then, of course, there are cases in Cuba. So let's take a look and find out what's going on there. Give me a second. Let me pull some of these other articles off the screen. Yeah, I was correct on the H3N2 subclade, I think it is. Subclade K is causing cases to spike in other countries as far as this flu variant. The UK, Japan, and Canada. Of course, Canada is right by us, the USA. So very easily can be spread over here. That was the flu variant. Okay, we talked about the measles situation. I think they're up to, it's been reported 168 people are currently quarantining with the measles. And I think that's South Carolina's public health, the Department of Public Health reporting. So take all this stuff serious. All right. So recent Florida cases of chikungunya, if I'm pronouncing that right, linked to Cuba travelers. And before I go on, this was also mentioned with the measles that some of those cases might be people who are somewhere else and they brought it back to South Carolina. Okay. And now they're saying this chikungunya or chikungunya linked to Cuba travelers. So we have all these folks from other places coming into the country and making everybody sick. Okay. So linked to Cuba travelers, reminder vector-borne illness is still circulating. Okay. They're saying it's still circulating. Just give me a sec. All right. During this time of the year, much of the U.S. becomes too cold for mosquitoes to transmit vector-borne diseases. However, chikungunya is still transmitted in tropical environments. For example, 29 countries in the Caribbean region have documented cases of this disease as of December 1. Particularly hard-hit country has been Cuba. Over 38,000 cases of chikungunya have been reported in Cuba this year, with 21 deaths. Let me see something real quick here. Okay. United States travel associated cases have exceeded 200, which hasn't occurred since 2016. Imagine that. Recently, the Florida Department of Health reported there were 149 confirmed cases of chikungunya among people who have traveled to Cuba or Cuba. The Miami-Dade County area alone accounting for 95 cases this year. Almost all the patients in the United States who are diagnosed with the infection acquired it while traveling internationally, generally in a tropical region. So take all these notes, make these mental notes about like where they occur at. Start educating yourself when I'm reading this stuff, and so you'll be more informed, and then you be more mindful when you start traveling, or you other people are traveling. Even if there aren't cases or nothing happens, you'll be mindful. Like, okay, tropical regions. These are where you can find these viruses, or the chikungunya virus anyway. Tropical regions. And anyway, so almost all the patients in the United States who are diagnosed with the infection acquired it while traveling internationally, generally in a tropical region, and then come home. And shortly after they return, they have a fever. Keep that as a note. Note that, and often have severe joint pain. Write those down in the notebook. Educate yourself. I'm giving you the information. Write it down and keep these notes. All right. If you don't have a notepad or anything, play this video back later and jot down these notes. All right. So they come home shortly after and have a fever and often have severe joint pain, which can be what triggers to think specifically about chikungunya virus. All right. This is according to Andrew Handel, MD, pediatric infectious disease physician at Stony Brook Children's Hospital and Stony Brook's Regional Tick-Borne Disease Center in Hampton Bays, New York. All right, locally acquired cases of chikungunya are extremely rare in the continental US. See what I'm saying? It's being brought by other countries. But there has been some locally acquired cases, mainly in Texas and Florida. But there was a single case in New York State earlier this year, which would be the first in the state's history. In terms of concerns around local acquired cases, Handel says there are two main ones. Sometimes we worry about mosquitoes sneaking their way onto airplanes, and then making their way locally where they can bite someone who's not living in an area where they have chikungunya or other tropical viruses. And the other concern is, as we see changes in climate and more warmer winters, more warmer summers, is it possible that the virus will be transmitted by our local mosquitoes again? Question mark. At this point, there's no evidence to suggest that it is being frequently carried by mosquitoes in New York and other states, according to Dr. Handel. So the treatment, unfortunately, they're saying there are no antivirals to treat the disease. All the treatment that's offered is symptomatic and is based on providing supportive care to patients. Individuals with chikungunya very rarely are severely ill, according to Handel. The main symptom is joint pain. So they might start patients with NSAIDs, NSAIDs. I think I'm pronouncing that. For those who have prolonged joint pain, according to Handel, they might add a course of oral steroids to help with the symptoms. So let's look at the prevention real quick. For those who are traveling to areas with chikungunya is endemic, there are vaccines that are available. Individuals can speak with their providers about getting the vaccine. Man, I'm getting very leery about the word vaccines now. Prior to travel, okay? Additionally, there are insect repellents that can help mitigate or lessen mosquito exposure. We usually recommend DEET as the major compounds within the insect repellent. DEET 20 to 30% is the typical recommendation because it stays on at least 3 to 4 hours at a time, so it doesn't rub off too quickly. Again, that is DEET 20 to 30%. DEET 20% to 30%. All right. Uh, let's see, stays on at least 3 to 4 hours at a time, so it doesn't rub off too quickly, and it does a great job of preventing those mosquitoes from biting. There are a number of other compounds that are available, like picaridin and eucalyptus oil. The CDC has great information for providers about which ones they can suggest to their patients and what are the pros and cons of those outside of that. For people who are going to be in areas where there is heavy mosquito burden, they may want to advise their patients to treat their clothing with permethrin. This is another chemical compound that goes directly onto the clothes, not onto the skin at all, because it's toxic to the skin. Once the clothes dry, the patient can then wear it. All right. So beware of chikungunya. It looks like the Cuba travelers, the chikungunya is being linked to them. All right. So let's move on and see what else is going on in the US. Okay, we just talked about Florida. We got the flu cases. Let's see what else is going on. And we might change maps here in a minute and go to the global incident map. Right now, we are on the health map right now. Looks like dengue, chikungunya. I see chikungunya. Some people probably call it that, chikungunya. Chikungunya and oropoche reignite health alerts in Cuba. Okay, Ohio, flu cases surge in Northeast Ohio as new variant spreads. California, a salmonella outbreak linked to Vega Farms eggs has sickened 63. That's California. And then you have some Mexicos. We're going to skip that for now. Trying to stay into the US. Let's take a look at Ohio and the salmonella case in California. So let's look at Ohio real quick. Okay, flu cases surge in Northeast Ohio as new variant spreads. Okay, flu cases are surging across Northeast Ohio as a new variant spreads through the region, prompting health officials to urge residents to get vaccinated before the holiday season intensifies. A pediatric office in Westlake reported having a lot of flu cases with patients presenting symptoms including cough, congestion, and fever. All right. It's not too late to go and get the flu vaccine. It's incredibly safe. Again, I'm just saying be very cautious with all of this stuff, this vaccine stuff. Be very cautious and inform yourself with as much information so you can make the right decisions on any of this stuff. All right. It's not too late to go. Okay. It's incredibly safe, effective. I'm not trying to promote none of this stuff. I'm just reading. But I'm saying definitely inform yourself. That's the best thing. Information will help you make better decisions. All right. The H3N2, we already talked about that. I guess it's made its way to Ohio too, huh? Subclade K variant is causing particular concern among doctors. There's also something called the subclade or clade. I don't know how they pronounce it. I'm saying subclade K, which is the more intense flu. It's an H3N2 variant. That is a much higher infection rate locally than we are seeing an increase in subtypes. That's contributing to some increased severity of disease, probably a component of people not feeling as okay as they might otherwise, that they felt with milder strains prompting visits to the hospital. Okay, that's Dr. Robert Hughes discussing that. All right, so that's Ohio, right? Let's go to California real quick and see what's popping off there. With the salmonella outbreak, let's see if we can get the English. Is there an English translation? Let me see. And so, how does Japan know what's going on? I guess everybody got to keep tabs on everybody, huh? Yeah, we won't be able to pull up this information on the salmonella. Let's see if we can find it somewhere else real quick. We got resources to look these things up. Let's see if we can find it elsewhere. Give me a few seconds here, and let's see if we can find out some intel on this. Stand by. I'm gonna pull up this information and see if we can. Little quick search. All right, let me see. Health officials in California have linked salmonella enteritis outbreak to Vega Farms in shell eggs. So far, about 63 people have become sick after eating or being exposed to these eggs. Again, that's Vega Farms. 13 people have needed hospitalization because their symptoms were severe. There are no deaths being reported about that thus far. The egg recall on December the 5th, Vega Farms of Dixon, California, voluntarily recalled eggs after samples from the farm and the environment tested positive for salmonella, and the strains matched those making people sick. Again, the recalled egg details Vega Farms brown eggs. The handler code is 2136. Julian dates 328 and earlier. Sell by dates December 22nd of 2025 and earlier. Package sizes 1 dozen cartons, 30 egg flats, 15 dozen food service cases, 6 flats of 30 eggs. These eggs were distributed to grocery stores, restaurants, co-ops, farmers markets in Northern California, especially in Sacramento and Davis areas. The health officials are saying do not eat, serve, or sell the recalled eggs. If you have them at home, dispose of them safely or return them for a refund. Clean and sanitize surfaces and utensils that may have touched the eggs. If you started cooking with them, watch for symptoms and contact your healthcare provider. Okay. Salmonella outbreaks from eggs aren't new. Eggs can become contaminated either on the shell from environmental contact or inside the egg before the shell forms, if hens carry the bacteria. Again, get yourself a little notebook and educate yourself of stuff I'm reading to you. You'll be well more informed. But this outbreak in California just shows how quickly problems in processing or sanitation can turn into a public health event when products get distributed widely. The state is investigating to figure out exactly what went wrong at the farm. Common salmonella symptoms include diarrhea, fever, abdominal cramps, nausea, or vomiting, right? Okay, so let's move on, see what else is going on here. Let's drop this down and let's just take a look. We got this big dot. Let's see what's going on here. Is that the new flu variant? Let's see if this is an I just want to see something real quick here. A lot of flu variants. They saying new flu variants. Yeah, I think we went over this already. The H3N2 is the apparent flu variant, the new flu variant, I guess. Okay. Okay. Let's see what's going on in these northern western states here. Foodborne illness. Outbreak linked to restaurant sickens at least 35 people. That's in Seattle, Washington, or close by. Let's see what's going on there. Let me see. Well, today's the 16th. It's probably been about a week. So, public health officials in Seattle are investigating a foodborne illness outbreak that affected 35 people during that's the Thanksgiving. They're saying, oh, okay. They so late on reporting this stuff. They're reporting it in December, but the outbreak happened during Thanksgiving. They're real slow, man. See, this is another thing to be aware of as well. A lot of things can go down because it's the same thing that seemed like it happened with the COVID situation back in what 2019. They're saying that stuff started as early as in 2019, like in August, September-ish, and then started going on, and people didn't have a clue. So that's another thing to be mindful of. That's why I'm glad we were reporting this stuff. So y'all can be protected and defend yourself. So we don't people don't get caught out there again on something major. So we try to keep y'all up on things early. Just like when we reported the measles situation, I think a couple of weeks ago in South Carolina, and it's looking like it's increasing now. Who knows how far it will spread in other states and stuff like that if their Department of Health don't get a hold on things in South Carolina, Spartanburg County, allegedly, right? Okay, the health department reports that all 35 patients ate food from Kanishka cuisine of India. Whoa, 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 whoa. Okay, Indian food. That's all I'm going to say. You know the rest. The patients either picked up the food for carryout or received it by delivery. Illnesses began on November the 28th. We haven't found a specific food or drink from the fusion Thanksgiving feast menu that caused this outbreak. However, the illnesses match what we see with bacterial toxins. These are poisons made by certain bacteria that can grow quickly when food is left at room temperature. When that happens, the food can become contaminated and make people sick. The outbreak appears to be over, but the investigation is ongoing. The restaurant was temporarily closed. The sick people reported one or more symptoms such as diarrhea, stomach pains, nausea, vomiting, fatigue, headache, and body aches. You know, something you will find in the flu, right? Right? And it's a foodborne illness. The health department did not find any sick restaurant workers with signs of gastrointestinal illness. On December the 2nd, health inspectors visited the restaurant and found several problems that could have contributed to the outbreak. Not having the proper equipment or kitchen space to safely prepare both their regular food service and the extra food for the fusion Thanksgiving feast. The cooling methods they used may not have brought the food down to a safe temperature. Some foods weren't kept cold enough to stop bacterial toxins from growing. We provided education to the establishment on how to cool food safely and reminded them that they must limit the scale of their food preparation to what has been approved by public health. On December the 4th, we went back to the restaurant to check if the earlier food safety problems had been fixed. During our visit, we saw that food was still being cooled improperly. I guess that's just from this Indian restaurant, and that items requiring refrigeration were being kept at room temperature. The health department reported. Because these issues could make people sick, we closed the restaurant until they are fixed. While closed, the restaurant threw out unsafe food and will be retraining staff on safe food handling. So when you get a store of food or restaurant of some type, please educate yourself on these things. Don't be the one caught out there and exposed and we report it. Okay. So let me see here. Test on 4 sick people came back negative for germs that commonly cause gastrointestinal illness in people like norovirus, salmonella, and Shiga toxin producing E. coli or STEC, STEC. However, these tests don't check for bacteria that make toxins. Illness from bacterial toxins usually starts quickly after eating and ends within a short time. By the time someone sees a doctor, it is usually too late to test. Okay. Bacillus, I think that's how you pronounce it. Bacillus cereus, I think that's how you pronounce that. And Clostridium perfringens are both bacteria that grow fast at room temperature and produce toxins that can cause vomiting and diarrhea. Both bacteria are also naturally found in the environment. Outbreaks often happen when large batches of food are cooked and sit out too long at room temperature, between 40 degrees Fahrenheit and 140 degrees Fahrenheit. Some food linked commonly to these bacteria include meats, rice, leftovers, sauces, soups, and other prepared foods. Contaminated food stored outside of safe temperature ranges may allow for growth of the bacteria or their spores. Bacteria with a tough outer layer, refrigeration and cooking help reduce the risk, but don't eliminate these bacteria or spores. All right, so that's that on that. Let me just remove some articles here. Let me see. We talked about the measles outbreak in South Carolina. All right. So now, let's see what else we got here. Further, the Western, if you split the US in the middle, if you put a line down the USA, everything on the west of that line, doesn't seem to be a lot, but there seem to be more increased dots as you see on the screen when you go further east. Let's see what's going on in New Jersey. Environmental, what else they got here? What's going on? Patient dies after dangerous bacteria found in St. Joseph's Hospital. Wow. what's going on with that. It's got 1 star on it. Let's see what's happening here. Let's see. Patient dies after dangerous bacteria found in St. Joseph's hospital water. A New Jersey hospital is notifying former patients after a patient died and subsequent state testings found Legionella bacteria in part of the facility's water system. Look up Legionella and educate yourself on that. Testing by the New Jersey Department of Health found the presence of Legionella in the water supply of one contained area of St. Joseph's University Medical Center in Paterson. According to St. Joseph's Health, hospital officials said the discovery prompted remediation measures and patients' notification. We have been working closely with the state and local health officials after a patient was treated for multiple medical conditions and also tested positive for Legionella. That's Dr. Joseph Duffy, Chief Medical Officer of St. Joseph's Health, said, unfortunately, due to the complex nature of this individual's medical condition, the patient succumbed to the illnesses. All right. Symptoms of Legionnaire's disease can include cough, muscle aches, fever, shortness of breath, and headache, according to the health system. Less common symptoms include diarrhea, nausea, or confusion. That's the less common symptoms. Officials said most healthy people do not become ill after exposure, and the disease is not normally spread from person to person. Okay. All right. So that's Jersey. Let's see what else is going on in Jersey. There's one more something going on here at the borderline. It looks like of Jersey and New York. What is this about? Let's see here. Monaco reiterates its commitment to the preservation and protection of marine ecosystems in New York. All right. Let's see what it's saying real quick. If it's any dangers, yeah, let's translate that into English. It's written in French. On December 8th, 2025, the United Nations General Assembly debated issues related to oceans and the law of the sea, namely sustainable fisheries, the agreement on the conservation and sustainable use of marine biological diversity in areas beyond national jurisdiction, BBNJ agreement, and the future United Nations Oceans Conference, which is the UNOC4. All right, I'm gonna leave that at that. They're talking about conserving and sustainable the fisheries. I'm gonna leave that alone for now. Okay, what's going on here? Waterborne illness in Connecticut. Like some waterborne illnesses are happening too, something to be aware of as well. Some Waterbury restaurants stay open despite health order to close after water main break. They're trying to get that money as opposed to keeping people healthy. While the city has ordered all restaurants to close until boiling water is no longer required, following last week's massive water main break. Hold on, let me see what the dates are here. Yeah, it's pretty current. Last week's massive water main break, some eateries remain open Tuesday, with some saying they were never told to shut down. But the city's public health director says restaurants that have remained open could face consequences unless businesses have an alternate water source separate from the city's water supply. The city's water supply, the city's water supply. They can't operate while they might say they boil water advisory or the boil water advisory is in place. Health Director Aisling McGuckin said, per the FDA food code, which all food service establishments should be following to operate safely, they cannot operate under a boil water alert. End of story, according to McGuckin. Restaurants that continue to operate despite the boil water advisory are not following the guidance of the health department. So you have situations where these restaurant owners, we don't know what ethnicity they are and who owns what. They're trying to keep things open and make money while putting your or your family member's health at risk, is what it appears, allegedly, right? What's going on in upstate New York? Flu cases skyrocket in New York City. Let me see. New York Talk. Relaxing vaccine exemption could threaten the public. More than 50 babies affected by the botulism outbreak. Oh, yeah, the ByHeart. Okay. Wasn't that something in California again? I forget what state we just talked about reading that. So their ByHeart products are serious. So again, anybody you know that's has the ByHeart infant products need to tell them to get rid of that ASAP. Boy, 6-year-old dies after being found unconscious with an unknown illness. Let's see what the details are on that. Let's see what's going on with the children. A boy who was 6 years old dies after being found unconscious with unknown illness at Times Square Hotel. A 6-year-old boy died Tuesday after he was found unresponsive, unknown illness. The boy fell ill visiting the city with his family from Maryland, but his condition took a turn for the worse. Officers arrived at Hampton Inn on West 41st Street and 7th Avenue, 9:40 a.m. The boy was unconscious and unresponsive. He was rushed to the hospital, rushed to New York City Health. That's where he passed. The boy showed no signs of physical trauma. His parents told investigators that he was sick on the trip and had been vomiting. The medical examiner's office is working to determine his exact cause of death. Condolences out to that family. Got to pay attention to the kids, man. Most definitely. All righty, let's see here. What do we have here? Is this North Carolina? Yes, it is. Officials confirm chickenpox case at middle school in Haywood County. Chickenpox case confirmed at Waynesville Middle at Haywood County. South Carolina cases of measles continue to rise. We talked about that. State reports 3 more deaths. Uptick in flu-related cases. Kitten tests positive for rabies in Western Gaston County. Hold on. Let's see where that's going. Apparently, those are North Carolina. So it's saying North Carolina got skunks, cats, skunks. They're saying it's a rarity, but yet it still happens, even though it's a rarity. We see Gaston County. Police, animal care, and enforcement got a call from a local veterinarian hospital in reference to kitten under quarantine that was showing signs of rabies. This is a kitten that had possibly been exposed to a skunk showing neurological issues in the 800 block of Marys Grove Road, Cherryville. All right. So they're reporting this stuff late. And it might be due to how long it took for the kitten to start showing these signs. So, because they're saying in October, and it's being reported in this month on the 10th. So that's what, 6 days ago. So the information is moving slow, and it could be just because the signs weren't noticed right away. And man, from October to now, none of the felines involved were vaccinated, and one died because of the attack. The remaining cats were quarantined until the test results were received. There was no human contact with the skunk. The skunk test results later came back from the state lab positive for rabies. The kitten owner chose to have the kittens quarantined at a local veterinarian office for 4 months for observation in compliance with state regulations and at the owner's expense. The kitten began showing signs of rabies. It was euthanized and processed for rabies on December the 4th. The kitten was impounded by animal care enforcement specialists, then sent to North Carolina Laboratory of Public Health in Raleigh on December the 5th. Okay. That's important too, man. The rabies, not just the viruses and bacteria and all of that, catching stuff from animals as well. Let's see what's going on in Louisiana. The first U.S. bird flu death is announced in Louisiana. That was reported yesterday. Oh, no, this was earlier in the year. They just now coming to this. This is crazy. I'm not even going to go into this. So what's so ridiculous is how long they take to report this stuff. We talking months, and it's just now coming up. Older age, kidney disease, stroke tied to higher risk for potentially deadly illness after West Nile infection. Older age, kidney disease, stroke tied to higher risk for potentially deadly illness after West Nile infection. Older adults who have chronic kidney disease or cerebrovascular disease, affecting blood flow to the brain, such as a stroke, are at twice the risk for neuroinvasive illness, which can cause paralysis and death after West Nile infection. Researchers at the University of California, Los Angeles, and Johns Hopkins suggest. Okay. All right, let's check out some more here. A few more. Hold on. We need to go to the global map real quick. Did we remove that? No, we didn't. All right. Let's see if it pulls up here. We'll go to the global incident map. We haven't tackled the map yet. Hopefully it'll pop up. It's taking its time here. This thing is going crazy. There we go. So let's pull this up. Let's go to the global incident map, ladies and gentlemen. Let me make a quick switch. Where are we at here? There we go. There we go. It should pop up on your screen right now. And yes, it has. All right, let's zoom in a little bit, see what's going on here. We're in Africa and the European and the Middle East. Let's see what's going on in the US. Okay. Let's see, Arkansas. Okay. Experts warn of risk as Arkansas sees rise in whooping cough. The state of Arkansas has seen a significant increase of whooping cough cases. The doctors saying that the concern is the vaccine rate. Everybody talking about vaccine. A recent outbreak of contagious horse disease. That's in Arkansas, bordering Louisiana. Okay. That's that. Let me see. Let's go over some other areas here. Virginia, 30 vultures in Rocky Mount died from avian flu. State confirms. The dead vultures found in Rocky Mount died from avian flu. The Department of Wildlife Resources has confirmed approximately 30 vultures were found dead. So the avian flu hits them quickly. Let's see what the article is saying real quick. What's the date on it? Okay, December the 8th. The dead vultures found in Rocky Mount, okay, the avian flu. The finding brings the number of Virginia localities where wild birds have been confirmed to have died from the virus to 10. These have generally been black vultures, a carrion bird that eats dead animals, which makes them susceptible to picking up diseases. The tech professor, Michael Persia, a Virginia Tech professor and poultry nutrition specialist, told Cardinal News, or news source, I should say, last month that the number of vultures turning up dead from avian flu was unusual, but probably didn't represent a wider spread of the virus. Vultures move around more than smaller wild birds, which could help explain the recent cases, according to Persia. He says, quote, "My guess is that it's probably a one-off series of deaths and not a long-term indicator of a new spread pattern." Let me see here. The state of, let me see, all positive wild bird samples since December the 30th, since 2021. 422 in North Carolina, 246 in South Carolina. Who has the highest? 965 in California. Oh, Minnesota has 989. I think that's the highest. Okay. All righty. Let's go to Illinois, see what's going on there. More than 900 chickens killed after bird flu devastates Metro East farms. More than 900 chickens killed. Okay. A Metro East family farm is reeling after avian influenza swept through its free range chicken operation, wiping out hundreds of birds and leaving behind a field of feathers. These folks need to get a handle on this flu situation with these birds. You trying to sell stuff to folks. Whoa, let me zoom that out a little bit. There we go. All righty. Let's see what's going on in Austin. Whooping cough case. A case of pertussis, otherwise known as whooping cough. Okay. Again, that's Austin, Texas. Whooping cough case confirmed at McCullum High School. Over there by Phoenix, Arizona, we got the equine herpesvirus outbreak spreads in Arizona. A multi-state outbreak of, I think I'm pronouncing this right, equine Herpes virus continues to spread in Arizona. A fourth case has been confirmed this weekend by the State Department of Agriculture. Let's see what's going on with the article. Okay, that was in November. That was last month. A multi-state outbreak of the EHV1, equine herpes virus 1, continues to spread in Arizona. The latest confirmed case found in Pinal County showed neurological symptoms unlike the three previous asymptomatic cases. The outbreak originated from equestrian, events in Texas and Oklahoma. And the state is currently tracing back all potentially exposed horses to contain the spread. I think that, yeah, that's the horse virus, I believe. I remember we talked about that a couple of weeks ago. We clean 3 times a day. We change our water buckets twice a day. Every one of our horses has their own grooming kit. Yeah, this is regarding horses. This virus, the EHV, can affect the horse's respiratory and nervous system functions, can even be fatal and spread easily. You can get it on your shoes. Your horse can sneeze on you. You as a person can't get it, but you can transfer it to another animal. That's interesting. So our body's defenses can prevent us from getting it, but it can still be on us if you have a horse and the horse sneezes on you or it's on your shoes. It can be spread to another animal. That's interesting about human immune systems and animal immune systems. Okay. We're going to take a look at a couple of other places. We should go, international a little bit because it was being said that some of these things are coming from other places or potentially. What's going on in Montana? The whooping cough. Wisconsin, the flu. I'm just kind of skimming through now so you know what's going on in these states. The flu, bird flu. So we got measles, bird flus. We also have the food related stuff on the kids, the botulism. Confirms HPA. Fall migration of a wild waterfowl continues to drive high statewide risk of avian influenza. That's Washington State Department of Agriculture. Virus has killed almost 9 million birds and counting, according to DC. We just talked about the vultures and the avian flu. West Virginia, whooping cough. Bird flu and whooping cough going on in West Virginia, apparently. Kentucky. Third infant pertussis death. This first whooping cough death reported since 2018. Man, these little kids' immune systems is just not as strong. I think we talked about Louisiana, that horse disease. Yeah. Arkansas, whooping cough going on. Let's go to Maine, see what's going on in Maine. Bird flu warning after virus detected in Penobscot. I think that's how you pronounce it. In Penobscot flock. Maine animal health officials are urging bird owners to take extra precautions after avian flu was confirmed in a backyard flock. A lot of bird flus going on. We got measles cases going on. Zero human cases of West Nile. Zero human cases of West Nile going on in California. We talked about Florida and the situation there. Diseases possibly coming from Cuba travelers. California, suspected case of mumps identified on UC Davis campus. Let's look into that real quick. There's something different that we haven't seen. Working in coordination with the Yolo County Health and Human Services Agency, university health officials are conducting contact tracing to identify and notify those who are known to be in close contact with infected person at Mondavi Center for Performing Arts event on that date. A case of the mumps in the camp on the campus, they're saying. Let's pull that up real quick so you guys can see that on the screen. UC Davis is working in coordination with YOLO. Out of abundance of caution, an individual with a suspected case of mumps was on the Davis campus on the evening of December the 3rd, working in coordination with the Yolo County Health and Human Services Agency. Through the Mondavi Center, county health officials have reached out to those who sat near the person with a suspected case of mumps. People who were at Latitude Restaurant on December the 3rd between 6 p.m. and 7 p.m. also may have been exposed to mumps. Mumps is spread through contact with respiratory droplets. So people within a 6-foot radius of the case potentially were exposed and would be considered close contacts. Close contacts should monitor for mumps symptoms, isolate and seek care if they feel sick. They should consult their healthcare provider if they develop symptoms or have concerns, especially if they are not up to date on the mumps vaccination and immunocompromised or are pregnant. In the United States, the mumps vaccine is included as part of the measles, mumps, and rubella MMR vaccine, and it may be listed that way in a person's vaccination records. The University of California. All righty. According to the Center for Disease and Control, mumps is a contagious viral infection that can be transmitted through contact with saliva or respiratory droplets. Make that a note in your notebook. Spread by coughing. Make that a note. Sneezing, talking, or sharing drinking containers. It can take 2 to 4 weeks from exposure or symptoms to appear. Mumps symptoms often start like the flu: fever, headache, muscle aches, tiredness, poor appetite, and then include swollen, tender salivary glands causing puffy cheeks or jaw and often making it hard to chew or talk. So hard to chew or talk. So I'm wondering if that can be mistaken like having wisdom tooth pains. But you got to also look at and consider the other symptoms to go with it. So some infected individuals experience no or minimal symptoms, while others get severe ones like testicular swelling. Pregnant women who become ill with the mumps are at high risk during early pregnancy and should consult with their obstetric provider. If you are seeking care for symptoms such as these and are unable to address them through a telehealth appointment, please mask when presenting for care. Okay. All right. Let's get back to the map. Pull that back on the screen. Are we up? Yes. Okay. All right, so yeah, that's California, man. The mumps cases at one of the campuses. Let me see if I can spread this map out a little bit more and catch the other something else. Yeah, we get a little more detail, see what's going on there. Okay, that's the mumps case. And what's this one up here? Still talking the mumps situation. Okay. And we got the 0 human cases of West Nile. All right. So yeah, it looks like we covered the US for the most part. So now you're aware of what is going on in the United States. I'm gonna take just a few minutes to see what's going on in these other countries. What's going on here? Rift Valley fever, Mauritania. Okay, that's Mauritania in Africa. In Mali, Mali's health authorities have confirmed 5 cases of monkeypox. Let me see what's the dates on these. Okay, that's monkeypox. What's going on in Nigeria? Record 17 new Lassa fever cases as death toll climbs to 185. That's in Nigeria. Lassa. Nigeria has confirmed 17 new cases of Lassa fever across 4 states, according to the latest epidemiological report released by the Nigeria Center for Disease Control. That's Nigeria. Is this the Congo slash a neighboring country? New Ebola death confirmed in the Democratic Republic of Congo as country was close to declaring end of epidemic. So they had a new Ebola case. Ebola death occurred in the Democratic Republic of Congo. And they was getting ready to report that they were close to declaring, as the country was close to declaring end of an epidemic of Ebola. And they end up having the Ebola case. Namibia, what's going on there? Report second cholera outbreak of the year. Namibia Ministry of Health reported 6 cholera cases with 3 confirmed and no deaths. They're slow on reporting that. Namibia confirms H5N1. So in the States, we had H3N2, I think it was. And then over here in Namibia is H5N1. Namibia has confirmed an outbreak of highly pathogenic avian influenza in wild birds in the southern Karas region, authorities said on Monday. Okay, we did that. All right. It's like South Africa. Foot and mouth disease cases in the Free State province. The Department of Agriculture and Rural Development hereby informs the public and the entire farming community of 12 new confirmed cases of foot and mouth disease, FMD, in Frankfurt, Edenville, Bothaville, Paris, Denizville, South Solberg, Tweeling, and Verede. This brings the total number of confirmed cases of or in the Free State to 118. Foot and mouth disease. Ethiopia treats 8,600 malaria patients in Southwest Ethiopia. Outbreak response. Hold on, let me see something real quick. Established a 40-bed malaria ward at Mizan Tepe. Okay. And Addis Ababa, I think that's how you pronounce it. The 9th Marburg virus death reported. It seemed like there were some Marburg cases in the U.S. or the potential of them, and I guess they're gone. And there are some in Africa, apparently. Marburg virus disease outbreak in Ethiopia. The Ministry of Health reports 1 new death from Marburg virus disease on December the 13th, with no new confirmed cases, but 39 samples under laboratory investigation, signaling sustained vigilance in the country's first outbreak declared in late November. Okay. And I think that's all that's going on in Africa. Let's see what's going on in Yemen real quick. Provides cholera care, the emergency cholera response, supported by Saudi aid agency. That's Yemen. We got Spain. What's going on in Spain? First known human-to-human monkeypox clade or clade 1B transmission outside Africa. Health officials in Spain have documented what appears to be the first case of human-to-human transmission of monkeypox. That's in Spain. Near Barcelona, they have swine fever. 8 new suspected cases hits Spain's pork exports. Over here near London, outbreak of bird flu. What else we got here? What's this? Recombinant monkeypox virus detected in England. New monkeypox strain identified in England. What's up with the monkeypox going on there? Extra mutated superflu sweeps Britain. Extra mutated. NHS declares early flu crisis and warns of worst winter ever as experts suggest wearing masks. A troublesome mutant strain in the flu hitting the UK is believed to be more infectious and leading to more severe illness and hospital admissions than last year, while also leaving people vulnerable to catching other seasonal viruses at the same time. What's going on with this here? Bird flu. Over there in Amsterdam, bird flu. So everywhere near there seems to be getting the bird flu situation. Up in France, records first case of West Nile fever. Switzerland records first case of West Nile fever. A West Nile virus infection has occurred for the first time in Switzerland, specifically in the Ticino. According to the authorities, there is no risk to the population as the mosquito season is over and the virus is not transmitted from person to person. Belarus, Warsaw, Newcastle disease hits turkeys, laying hens in Poland. Newcastle disease. Y'all write that down and research that so you'll know what that's about. Hits turkeys, laying hens in Poland. All righty. Over there in Pakistan, cholera outbreaks, claims 8 lives, including 6 children. Karachi, first death from Congo fever reported. And near Ahmadabad and near Mumbai, a suspected case of Crimean Congo hemorrhagic fever, commonly called Congo fever, was reported in Amreli district. Health officials said an 18-year-old man from a village in Sarakundla Taluka developed fever and vomiting and was admitted to a private hospital in that town. New Delhi, what's going on in New Delhi, India? India's reduction in tuberculosis cases sets new standard. Delhi records over 200,000 respiratory illness cases due to toxic air. And over here near Dhaka, I think it's still India, yes. Dengue case spikes in Dhaka. And what else is going on in Dhaka? 200 more dengue patients hospitalized in 24 hours. Looks like a lot of cases here. With let me see, different dates, yes. dengue fever in Bangladesh. Okay. Over in Thailand, what's going on there? The dengue. Seems like in this area here, there's a lot of dengue stuff going on. In Laos, dengue. In Hanoi, surge in hand, foot, mouth disease cases in Hanoi. Vietnam's Ho Chi Minh City. And Funam, I think as you pronounce that. What they have going on in Funam? Hand and foot disease. What's going on over there in Thailand? What's going on here in China, Hong Kong? Let me see what's going on here. Chikungunya outbreak. So I think we have that in the US and they also have it in China. So, I don't know if it's related, if people are coming from China and coming to the US and bringing over chikungunya because it's so widespread, it's all the way over there. And yet we have cases in the US, I think. In the Manila, Philippines, Philippines bans pork imports from Spain, Taiwan over swine fever outbreaks. There you go. Over in Taipei, what's going on in Taipei? First case of domestic valley fever. A man in his 50s has contracted Taiwan's first recorded domestic case of valley fever, Taiwan Center for Disease Control reported. That looks like on December the 11th. In Seoul, what's going on in Seoul, Korea? I think that is yesterday. South Korea reports 2 more bird flu cases. Reported 2 more bird flu cases, pathogenic avian influenza, also known as bird flu, increasing the total number of infections of poultry farms this season to 10. Hold on, we got one more. Let me see this. Was there 2 of these? Oh, it disappeared on me, huh? Let's see if anything else is going on. What's going on over here? In Guam, additional pertussis cases in Guam. Yeah. So, yeah, ladies and gentlemen, hold on. Let's see what's going on in Hawaii real quick. First avian flu case detected in Kauai. I think that's how you pronounce that. And yes, reported on the 12th. Multiple state agencies are on alert after the first case of avian flu was found on Kauai in an endangered native duck that died at wildlife refuge. And yeah, we reported everything else in the U.S. So that is it, ladies and gentlemen. This was a long one this time around. Normally, I stay about an hour or so, but I think I just felt I needed to cover some more areas this time, kind of go around the world this time. So I appreciate y'all. I think our next one, the final one of this year, I think is on the 23rd, and then starting 2026, we might just do these once a month. And unless there's some breaking news in regards to any diseases, viruses, bacterias, pathogens, etc., then we will try to stay on it and keep you posted. So we got one more to go here for the end of this year. I think it's on the 23rd. So definitely stay with us. This is the Pandemic News Report. You can find us on YouTube. We are on Twitch. We're on Twitter. YouTube. Okay. And I think next year, maybe you want to start setting it up this year, but you can also, we think we're going to start archiving, not just here, not just this news, but a lot of our other media outlets, our news, our podcasts. It'll start being archived on archive.org, I think it is. So you can catch news You can catch podcasts. What else we got going on? It'll be well, I won't say it right now. I'll put it that way, but we'll let you know some more details. All right. So anytime we'll start archiving them. So when people need to do some research, they can go to this particular site and we'll give you the name of it and the link so people can always go back. And then not just pandemic news report, we also do our Black news, what's the 411 news. We also have the presidential news brief. We have podcast shows. We have Black history channels. So everything is going to be all on one place and you can always archive it because, Facebook, I've noticed, we don't know what YouTube is going to be doing, but Facebook has been removing videos after so much time. I don't know what the purpose is. And, sometimes we tend to think that it's possibly to make sure that information doesn't stay where people can go back and try to find it. And especially when certain entities, certain peoples or execs or companies or corporate entities do something that is messed up towards the general public, I guess they can remove all the videos. But thinking about that, they're removing the videos, but maybe they still have it archived themselves. It's just that the public won't be able to see them anymore. So the content is probably still saved on their little things. So there's no telling what Facebook is actually doing with these videos that is removing every so often. They're getting ready for something for the 2026 year. So who knows? All right. So we appreciate y'all, man. Thank y'all for checking in. As always, love it when y'all come in and check us out. We see some of y'all watching us on Twitter, YouTube, and I see somebody on Twitch there checking us out as well. We definitely appreciate y'all. As always, we're going to keep you informed with all the disease, health, global health threats, because I don't think this was done during the time when the COVID and the pandemic situation happened. Everybody was reporting it as it was going down. There was nobody keeping track of the diseases that was going on prior to this. So that's why we're going to start doing that on top of just still bringing you other news as well. So with that being said, this is the Pandemic News Report. Much love to y'all. Appreciate y'all. And we are out. It's the global, live, real-time global health threats watch. Check us out again one more time for the end of this year. I think it's the 23rd. Don't quote me on it, but stay tuned, all right? No doubt about it. We're keeping y'all informed. Pandemic News Report, and we are out. Peace. And now, here is your Pandemic News Report.